They're someone's son or daughter, friend. They could be someone's father or mother. So these are really, really hard to see.
At St. Michael's Hospital in Toronto, ER staff have been noticing a startling rise in what they are calling complex overdose cases from opioid use. In February alone, the hospital's ER treated roughly 50 overdose cases in a single week. ER Deputy Chief Dr. Garrick Mock says usually that number is roughly 20. The rise, he believes, is being caused by a toxic batch of street drugs.
What we're seeing now is that the drug supply is actually contaminated with something called medetomidine. And when that happens, we will still give the naloxone, and that will help with the initial overdose of the patient. But what happens afterwards is that they actually go into withdrawal after. And these withdrawal patients are actually very difficult to manage. We have to give different therapies than what we would normally give, and then they require a lot more monitoring.
And the rise is being felt throughout the city. New data from the Toronto Overdose Information System has found paramedics responded to 350 calls for suspected non-fatal opioid overdoses in January alone. In 2025, that number was 229. On Augusta Avenue, Bill Sinclair is preparing for another day of patience. At the Kensington Market Overdose Prevention Site, the space is one of very few supervised consumption sites still operating in the city.
I don't know how we're going to keep up, honestly. It's gotten so much worse so quickly.
The center recorded more than 1,000 visitors in February, although in 2025, that number was roughly 500. As part of its services, the center also offers testing of drugs for individuals, with staff noticing a large volume is also contaminated with medetomidine, a tranquilizer intended for use only in animals. Sinclair says teams like his need more support, like funding, to keep up with the demand.
Recently, we had 5 people overdose in the same 2-hour period in our neighborhood. We were able to go out and save those 5 lives. But we can't keep up, and we need a whole city, whole province approach because people are dying.
Toronto Public Health says that they are monitoring this situation as overdose cases continue to evolve.
But advocates worry that more support is needed quickly at supervised consumption sites, with concerns that overdose numbers could increase even further by the spring. For City News, I'm Alessandra Carneiro.